So what does the day in the life of a pharmacist look like in general practice? And we're looking at a senior pharmacist here. So to give you a bit about my background, I'm a prescribing pharmacist. I work in a GP surgery right next to my GP and nurses room, in a room exactly like this, in a patient-facing role. So at about 8 AM to 9 PM, I'll be responsible for doing the repeat prescriptions, be able to sort them out, sort out any medicine-related issues, issue prescriptions as well, ensure that all patients have had their management condition reviews in time, so looking at clinical medication reviews, long-term condition management, liaising with other healthcare professionals, community pharmacists, hospital pharmacy teams, responsible for triaging this process away. When you notice that someone's had adherence problems, not really complying with medication, put them in with a review yourself, or with a GP, or with a nurse quite adequately. And being a prescriber, I have the ability to sign prescriptions within my scope of practice and competency, which actually substantially reduces the workload within our GP surgery. What we've noted from some of the data we've collected is that by having a pharmacist at the helm of the repeat prescribing process, you naturally add a layer of pharmacovigilance to this process, which obviously will help best use of medicines, repeat medications that patients are using. Between 9 and 10 AM, I'll be responsible for clinical posts and document. So document is basically the electronic letter system in a GP surgery. I'll be able to review some of this information, action it, call on others to action it as well, and triage as well, but it contains really important information on this clinical post. So we talk about discharge summaries, we talk about our outpatient treatment recommendation letters that take forever to go through our current system at the moment. And by having a pharmacy, we have to action them within a 24-hour span, which is quite impressive and prevents any delay in treatment. And between 10 AM and 1 PM, I start my clinic. So I'm not going to go into absolute detail because I'm conscious of time as well. So this will involve long-term condition management, clinical medication reviews within GP surgeries, and also looking at home visits. So I'm going to elaborate on this more, this idea of bringing care closer to home. So actually I'm going to patients' homes, doing bedside management of long-term conditions, but a little bit extra, looking at full risk assessments, dementia screening, care plan formation, ensuring patients have the best form of care. Interacting with health and social care is such an extremely important part of home visits, particularly when patients have just been discharged of hospital, have poor mobility, need meals on wheels, need extra support. And I think that shows pharmacists might within this area. And other appointments on the day, so spirometry, I can do child immunisations, diabetic foot checks, the list goes on. Between 2 and 3 PM, I'll be responsible for clinical management. So this is just ring-fence time for me to sort out any medicine-related issues, liaise with other healthcare professionals, particularly secondary care consultants or pharmacists or community pharmacists. Audit work in general practice, so we've got tons of audit work that we have to do. QOF, quality outcomes framework management, CQC prep, mentoring of other staff. So actually, I train nurse trainees, I train GP trainees as well as pharmacist pre-registration. So it's really important, probably one of the best parts of my role, to be honest. Between 3 and 3:30, I'm responsible for analysis of pathology and path links. So I'll be able to review results of this, and they're allocated by my practice manager, identifying abnormal and normal results and knowing what clinician should be booked in for that as well. And then between 3:30 to 5:30, I'm responsible for clinics. So looking very much like earlier as well, and I have the ability to offer extended hours up to 8 PM in a GP surgery, which is beneficial not only to the practice, because you get remuneration for that, but actually increases access to the local population, particularly the working population. I think it really benefits for them. So at the moment, I've got some outcomes, and they're being hopefully validated by a couple of higher educational institutes now for some publications, I hope, very soon. So we've been able to see that pharmacists in GP surgeries have been able to exceed all prescribing targets within our surgery by having a pharmacist in control of medicines management in the surgery. We've had some improved chronic condition outcomes, and we've got some of the best diabetes outcomes in a couple of our CCGs, and we're able to measure that quite nicely because in our surgeries we can't employ a nurse for the life of us. So actually it's very much a GP pharmacist model that's actually running long-term condition management. Reducing A&E admissions, particularly in asthma and COPD. So from last year, we managed to reduce it by greater than 40%. And this is not just by having a pharmacist practitioner prescribing antibiotics or oral steroids, for an exacerbation. Actually, this is a pharmacist doing the monitoring reviews, annual reviews, identifying patients on inappropriately high dosing corticosteroids or using greater than 12 salbutamol inhalers a year, creating specific management plans for these patients to improve their actual long-term care.